I'm Vicky, one of the teacher practitioners, and this Responding to Symptoms lecture is going to be about child health. The aim is to provide an overview of common paediatric conditions that you'll see coming into the community pharmacy. Some of these areas we will have covered in other Responding to Symptoms lectures, but here we're going to focus just on children. By the end, you should be able to ask patients appropriate questions and able to help you diagnose conditions and advise on appropriate management. Identify the warning symptoms and signs that we need to look out for and when it is appropriate to refer. Give advice on over-the-counter preparations and any non-pharmacological advice, and be able to counsel patients and carers on how to administer medicines to babies and children. These are some of the common paediatric conditions that you'll see coming through community pharmacies, but we're going to focus on the ones just on the left-hand side. Taking a good history is important, and obviously that's quite difficult with children because they find it difficult to articulate their symptoms. You need good listening and questioning skills. Understanding that parents and carers are going to be anxious about the child. You need to listen well with empathy to be able to gain their confidence. These are the general red flags for paediatric patients and when you should refer, no matter what condition they're presenting with. Children can go from being quite well to quite poorly quite quickly. So any of these symptoms need urgent referral. Pyrexia or fever is raised body temperature, and this is a symptom, not a disease. Normal body temperature is about 36.5 to 37.5 degrees centigrade, and if you have a child of under 3 months with a temperature of above 38, then you should refer, and if they're 3 to 6 months and the temperature is above 39, you should refer. Common causes, it could be post-immunisation, so post their normal vaccinations, they can get a fever. It could be due to infection, whether most commonly respiratory tract infections or urinary infections, and common childhood diseases, so anything like chickenpox, whooping cough, measles. Associated symptoms with fever will depend on the cause of the fever, but common examples are excessive sweating, headache, muscle aches, weakness, fatigue, cough, sore throat, rash. Generally, it's unlikely that it's serious unless it's accompanied by things like vomiting and an on-branching rash. There are 3 goals of treatment. Reduce the temperature, prevent dehydration, so humans will lose a lot of extra water from skin and lungs during fever. So you need to look out for those signs of dehydration and assess or monitor for any life-threatening illness. How are we going to do this? So we can use antipyretics. NICE recommend using either paracetamol or ibuprofen, and you continue to do this as long as the child is distressed. Consider using the other agent if the stress is not alleviated, and generally they advise not to give the 2 together. Only consider alternating the 2 if the distress persists and the temperature is not coming down before the next dose is due. Encourage children to drink cool, clear fluids. Not just water, because they can also lose glucose and electrolytes too. This can be quite difficult, particularly when they're ill. So for an older child, you can try and get them to have small, frequent sips of water. And for a younger baby, I found using an oral syringe and just syringing in a few mils of water frequently helps to keep them hydrated. Febrile convulsions can occur in young children when they have a fever, most common in those aged 6 months to 6 years, and it's due to a rapid rise in temperature. They can be frightening to witness, but they're usually harmless, and children are often awake and acting normally about an hour afterwards. The body will go stiff, arms and legs can twitch, they can lose consciousness, they may wet or soil themselves, they can be foaming at the mouth, and the eyes can roll back. This requires an urgent referral. What do we need to know? Who is it for? Is it a baby, infant or child? The age of the child will dictate what dose of medication we can give. What are the symptoms? How high is the temperature? Are there any other symptoms with it? Have they had a seizure? If they have, what happened during that seizure? How long did it last? Have they tried any medication to help bring down the temperature? Is the patient or the child on any other medication? Do they have any other medical conditions? In particular, do they have epilepsy, or have they had febrile convulsions before? When do we need to refer? So a lot of these will be the similar symptoms as the general referral for paediatric patients, but are there any indications that this could be something like meningitis, septicemia or pneumonia? Have they had any treatment and it's not responded? If there's been a fit or a convulsion, if the fever's lasted more than 5 days, is the child crying constantly, or is their cry different to their normal cry? Going to move on to coughs and colds. So this was covered in your Responding to Symptoms lecture on respiratory as well. So we'll just briefly go through this. Colds are viral. Children have no immunity, so they get lots of colds during the year, and as they get older, they slowly build up their immunity and get fewer colds. Most go away in about 5 to 7 days. Coughs are caused by the mucus dripping down the back of the throat and normally go away within 3 weeks by themselves. They can be caused by colds, allergies or acid reflux. Some little things we can do to help sometimes is use a pillow to raise the baby's head. So you can put a towel underneath the mattress just to raise it slightly, and that helps them to breathe a bit better, particularly when they're trying to sleep. You can use something like a humidifier to reduce moisture in the air, which can also help them to breathe better. Some treatment options, so you can use saline nose drops to help sort of dry up the snot and relieve that stuffy nose. Try and encourage the family to be washing his hands as much as they can to stop it spreading between the whole family. We can use paracetamol and ibuprofen, as long as ibuprofen is not contraindicated for the fever and pain. And there's also honey and lemon can help soothe the throat and moisture the throat. For those over the age of 6, as we said in the respiratory lecture, you can also use antitussives, expectorants and decongestants over the counter. We need to refer if the cough has gone on any longer than 3 weeks. If the temperature is really high and you're worried that it could be a chest infection, obviously antibiotics will be required, so they'll need to go and see the GP. If the cough continues for a long time and it's worse at night, or it's brought on by exercise, or there's any wheezing, this could be a sign of asthma. So there needs to be referral for some further investigation. If the child is having any difficulty in breathing, or they've got rapid breathing, they'll need to be referred, and any signs of dehydration. So now we're going to move on to pain, and again we covered this in the musculoskeletal lecture, so we're just going to briefly go through with regards to children. We have a choice of ibuprofen or paracetamol for children. Aspirin should not be used in children under the age of 16, and this is due to a risk of Reye syndrome. Ibuprofen is the only licensed non-steroidal anti-inflammatory over-the-counter for children, and it can be used in those above 3 months. It's particularly useful in dental pain, but it can cause gastric irritation, so it's best taken with or after food, and it is cautioned in asthmatics because it can cause bronchospasm. Paracetamol, there's a sugar-free option, which is good, and it can be used in those above 2 months of age. It doesn't cause respiratory depression, but it can cause liver damage in overdose. So it's important to double check the dose for each child, and that will depend on what age they are. Referral is required if there's severe pain, if the pain is going on for long periods of time or worsening, if they've tried any treatment and it's failed, if there's any abnormal drowsiness, loss of consciousness or difficulty in breathing with the pain. If you suspect migraine, then this should be referred to the GP as well, because products available over the counter are only licensed from the age of 11. Our next topic is teething, and this can be the cause of many sleepless nights for parents and carers, and it's one of the most common causes of distress in young babies and children. Normally the first tooth cuts around 6 to 7 months of age. What do we need to know? How old is the child? Again, that will dictate, or it will affect what dose of medication we can give them. What are the symptoms? Are the gums red and swollen? Do they have red cheeks, dribbling, any fever, nappy rash? How long has the symptoms gone on? Has this been days, weeks? Have they tried anything to help? Is the child on any medication, or do they have any medical conditions? So your general WAM questions. What can we give to help? So there's we can use paracetamol and ibuprofen liquid. There is some topical gels that contain local anaesthetics that help to numb the gum and help a bit with the pain. And there's also some homeopathic teething granules. Choline salicylate oral gel should not be used because of the risk of Reye syndrome. Some practical advice we can give: teething rings are useful. You can put them in the fridge for a while, and then when the baby chews on them, they're nice and cool and they soothe the gum. Raw fruits and vegetables are things like carrot sticks and are nice for them to chew on, and hardened bread, although no sort of sugary rusk biscuits. Give them nice, cool, sugar-free drinks, and try to play with them and distract them as much as you can to take their mind off the pain. They can drool and dribble quite a lot, so frequently wipe their chin because that helps to prevent any soreness and any rashes. And if they do start getting sore, you can use something like Vaseline as a barrier to help prevent that. We now have our first patient scenario. So you're in your community pharmacy and a mother comes in asking for some advice about her 5-year-old baby who has a fever. So which one of the following would you give over-the-counter advice for rather than referral? So this is typical of a multiple choice sort of question that you could get during your exam. So have a think about what you think is the most appropriate, and then we'll go through it in the next screencast.